So today we're going to talk about a specific muscle of the knee that is vital to proper knee function. If we zoom in just on this knee, we see the kneecap or patella, and it sits in this groove of where joint surface, you can see this smooth surface. The back side of this kneecap, if I flip it over, is also smooth. And this is what joint surface looks like when it's healthy. In order to keep it healthy, we have to take care of this muscle that's often overlooked, called the Vastus Medialis. It's this teardrop looking muscle. As I add in the quad muscles, you can see it has three poles, one up and to the side or outside, one straight up, and one up and to the inside. This Vastus Medialis, this is the one that's often overlooked because we don't quite strengthen enough with the right intensity to activate and preserve this muscle. It's a hard one because without the right intensity, we won't be able to strengthen this muscle. And if it's not strengthened, what happens is this then begins to pull more laterally. These two are in kind of a tug of war to help this kneecap track in the right groove. And without it, we're in a tug of war, and these guys are winning and starts to pull and flatten and put more pressure on this joint surface on the outside as well as on the back side of the kneecap. This leads to patellar chondromalacia and knee arthritis. So we're going to show you a few exercises to strengthen the Vastus Medialis and help improve patellar tracking. One of the concerns I hear a lot from my patients who are suffering with knee pain is the reality around the complexity of how the hip joint and hip musculature plays a part. So let me show you how that works. This is your leg from hip down to knee. And what we're going to do as we add muscles is identify the fact that, oh, we have this big, long tendon on the outside of our thigh that goes from hip all the way down to knee. This is called the IT band. The tensor fasciae lata muscle is one that sits inside that IT band, and it runs all the way down and crosses the knee. This is important because not only is it attached at the tensor fasciae lata, but if we flip it over and look at the glute here, we see there's significant connections to that tensor fasciae lata and fascial line, which is a rigid connective tissue, all the way down to the knee. And this helps to contribute to rotation of the knee. So if we're walking and we start to see that our legs or our toes are toeing inward, we're having poor glute activation to keep our toes tracking forward. Under those circumstances, we get more twisting and torsion occurring at the knee, which wears down the knee surfaces. So specifically, we'll look at joint cartilage as well as the meniscus. The meniscus are the cushions between the knees, and the cartilage is this smooth, specified, shock-absorbing tissue that breaks down over time. This is normal, but we can modify, we can change how quickly those break down by paying more close attention to the glutes. It's so important that we strengthen these glutes to help our knee health because these help to stabilize and maintain proper position of our knee as we run, jump, and functionally walk. I'm going to show you two exercises that are going to help strengthen the glute specifically for those who have knee pain on the outside of their leg. All you need for this is empty wall space. Come over, stand in front of the wall, and lean into the wall, and then walk your feet out until you feel like you're leaning into the wall, and if the wall wasn't there, you would fall over. So about 3 feet away from the wall. In this position, we're going to perform a wall sit at a 30 to 60 degree knee bend, which looks like this, just a slight bend in the knee. A full 90 degree would be as if you're sitting in a chair and my thigh bone is parallel to the ground. In this case, we're looking at 30 to 60 degrees, so just above that. Right here is a wall sit. This is the intro level. Both feet are working, toes straight ahead, my knees right on top of my ankles, and I'm looking at having my knee between my toes and my heel. I don't want my knee too far back on top of my heels. I don't want it too far forward either. We're doing this to put ourselves in a healthy position for our knee. I like the isometric hold for patellar chondromalacia or for any arthritis in the knee because this helps stabilize the kneecap so it's not rubbing or creating more friction across that joint, contributing to more breakdown. In this situation, we're stabilizing the kneecap and just working on strengthening the quad. If you already have arthritis in the knee, this is a great exercise because it's easy to do on your own, get appropriate strength, and not cause more pain. If you find you do have pain in this situation, then either come up a little bit higher, you can stand up a little bit more, and then start there. And then work your way down. As you get stronger, you'll notice you'll have more ability to get lower without pain. If this is too easy, the next move is we go to a single leg, so bring your foot underneath you. I'm going to do my right leg, I raise my left leg up. I'm in the same position where my knee is between my heel and my toes. I'm at a 30 to 60 degree angle, and we're still going to hold between 30 and 45 seconds, and we can build up to a minute, repeating 5 sets each leg. As you get more and more fatigued or tired, you're going to notice some quivering, some shaking, and you're gonna see this vastus medialis inside quad muscle start to shake and start to participate more, and that's what we're looking for. You can do this 3 to 4 times a week. The next exercise I really like for strengthening the vastus medialis, once my patellar knee tracking has improved, I've done the wall sits, and I'm ready for the next thing, is I like to do a heel elevated squat, because we want to get into deeper ranges of motion without pain. So you can use 10-pound plates, a 2-inch textbook, or anything that will lift your heels up about 2 inches. We still like to have the weight distribution pretty even from heel to toe. And in a proper squat mechanic or technique, we want our feet to be just about hip width, maybe just slightly outside of hip width. I want my toes to be either right at noon or like neutral, or out 15 degrees. Think of it like a clock. You're looking at 11 and 1 o'clock on the face of a clock. So just slightly outward if needed. As we squat down, we want to think about pushing our knees out so they still track right over our second toe of our foot. This is important because it helps to keep the arrangement of all the muscles that are going to be moving in their proper space so that they can be optimally used, versus allowing our knees to cave in or to be excessively pulled out. We're missing out on using all the muscles optimally. So with heels elevated, this allows us to track our knees out over top, as well as use a lot more muscles to help get us out of that deep squat without pain. So simply put, we're going to squat down, go as low as we can without pain. I like to get just below parallel, and then from there I'm going to assist by pushing down through my toes, but leaving my heels in contact with the platform, and then push back up. And we're going to smooth and steady repeat these. I like to do body weight first, and then add weight as needed. With heels elevated, it helps to enhance how much gastroc-soleus or calf involvement we're getting, as well as tracking appropriately. We're getting glute activation by pushing the knees out so they track over our second toe. 2 sets of 10 to 15 reps is sufficient to get the activation that we're looking for. Again, we want that deeper range of motion at below 90 degrees of motion.